Today I get the opportunity to talk a little bit about my experience with Crossing Rivers, not as an employee, but rather as a mom of a patient who's experienced extraordinary care here. I called the clinic to make an appointment for Charlie to see Dr. Huber, his primary care provider. She asked me, "Well, what are you noticing?" And I told her it's not just one thing, but I'll be honest, I'm worried he has leukemia. And we are so grateful and thankful that Dr. Huber listened to us. She said, "We're going to order this test." She goes, "It's going to make you feel better." She said, "I'm going to feel better." So the day went on. That night we went home. It was a Friday, and we had pizza as a family and kind of settled in for family movie night. And my phone rang, and I remember looking down thinking, oh, it might be a work call. And I answered it, and it was Matt Snitker. He was on call that weekend, and Charlie's lab results came back. And Matt was calling to tell us that Charlie had critical lab values. I don't know what we would have done without Matt. He was the voice of reason when I had what I like to call my deer in headlights moment. I couldn't think for a couple seconds in terms of what we were going to do next. I knew Charlie needed a blood transfusion, and he needed it now. But Matt really helped to be that calm voice and provide guidance on next steps. So we made the decision. We were going to drive that night to Stead Family Children's Hospital in Iowa City. And again, thank goodness for Matt, because he called ahead and the emergency department was expecting us that night. We were admitted to floor 11, which is the pediatric oncology floor. And I remember it being around midnight and looking out over Iowa City and the nurse practitioner sitting with us and saying, "I want you to get used to saying Charlie has cancer."
Hi, I'm Charlie. I'm 4 years old.
And with leukemia that he was diagnosed with, which is acute lymphoblastic B-cell leukemia, comes on very, very quickly. We were inpatient for a total of 9 days in Iowa City, and around discharge, we were talking about what our plan looked like. We needed to be within a 2-hour driving distance of Iowa City, and we're just outside of that. So there were a lot of questions about where are we going to receive care, and the answer was Crossing Rivers. For a critical access hospital to be able to provide care to a pediatric oncology patient is pretty tremendous. Cancer is scary, but a child with cancer can be even scarier, especially when that's not something you're used to dealing with every day. But the staff rose to the challenge. And over the course of Charlie's treatment, we made numerous visits to the ED, oftentimes in the middle of the night. Any fever that Charlie would get was considered a medical emergency, and our staff accessed his tiny little port just like he had it accessed at the Children's Hospital. I can't say enough about our lab staff. Charlie had quite a few local blood draws done here, and each and every time the staff were able to draw that blood first attempt. So for Charlie, over the course of his treatment, when you think about his port, which is a device that's implanted under the skin, a needle accesses it, and that's how IV chemotherapy is administered. Between chemotherapy administered through the port as well as oral, he's had close to 500 doses of chemotherapy. He's had 17 lumbar punctures. He's had 9 transfusions of blood products. He's had 2 surgeries. He's had 2 bone marrow biopsies and countless other IV antibiotics administered. Most of those antibiotics were administered here at Crossing Rivers. And what that did is that care helped prevent sepsis in Charlie, and it also helped Charlie from having to make another trip back to Iowa City. To be able to have that care delivered locally was amazing. I really want the staff at Crossing Rivers to know how extraordinary they are. And I truly mean that. You need to know that you kept a young child alive. You did that. And don't ever forget how important you are. No matter what your role is at the hospital, everything goes into that patient experience and into the care. And we have seen that time and time again. And we will forever be grateful for everybody that has been here and all that you have done to help keep Charlie alive and get him to the point where he's a happy and healthy 6-year-old boy.
Because when you think of Crossing Rivers Health, you don't think of pediatric oncology.
Your treatment is over. Hooray, hooray. Time for you. You've earned the right to ring the bell. Crossing Rivers Health wishes you well. So ring the bell 3 times loudly. Your day has come to ring it proudly. Tell the world your treatment is done, and here's to lots of happy days to come.
So we started this journey when Charlie was 4 years old. 6 seemed like so far off. And here we are. He's 6 years old today. We're optimistic about the future, and we're filled with hope with what the future holds.